Hey, I'm Dr. LeGrand.
And I'm Dr. James Starrett.
Welcome to our health show, and we're going to go ahead and get started right away.
So one of the things I really want to discuss right now is what naturopathic medicine is.
Yeah, I think that'd be good.
Because we get these questions a lot. People don't necessarily know what it is our profession does, and we do live in Seattle, where a lot of people do know what naturopathic medicine is, but especially as you start to get outside of larger cities, less and less people are educated as to what we do.
Yeah.
So one of the first things that I want to jump into, this is pretty funny. So a lot of times I'll say, I'm a naturopath. Or people will come up to me and they'll say, oh, you're a homeopath. Mm-hmm. Oh, you're a homeopath, right? And so I just want to clarify right now. So homeopathy is not naturopathy.
No, it definitely is not.
So now,
now
those who practice naturopathic medicine may practice homeopathy, but it is a specific avenue of medicine that is included under the umbrella of naturopathy.
Right.
It could be practiced.
Yeah, it's a one modality that that naturopathic doctors might use, but you got to understand, naturopathic doctors at the core, practice a lot of different modalities.
Right.
But we're primary care doctors. We're primary care doctors. We're family doctors. We just have different tools in our bag, and homeopathy might be a tool that maybe not all naturopathic doctors actually practice. I know you and I don't really specifically.
That's not our specialty. That's all that is. It's
specialty.
Not our specialty. But first and foremost, we are primary care doctors. Yep. We are general practitioners. We have that science training and that clinical training to recognize the same dangers in our patients, whether that be symptom-based in diagnosis or you're seeing through lab work. And so we have that same clinical training in that we can recognize when the patient is in jeopardy and we can diagnose disease. The difference is in the actual model for care. And would you like to speak a little bit about?
Yeah, I mean, for the model of care, and I think every naturopath doctor might do it a little differently, but for any naturopathic doctor, it's trying to do least harm to the body, right? So usually our model of care is trying to implement lifestyle changes at first to see if that is, or even taking things out of the picture that might be causing the problem. So it might be environmental of something that's causing the issue, that trying to look at those aspects that might not do harm. And then moving towards, and of course implementing nutrition. That's another thing, that are simple things that we can be changing in our body that's not going to do harm. And then maybe moving to supplements that might help, that also aren't as invasive. And then moving down the pedestal if we have to implement medications and surgery and so forth that are more invasive. So really that's really how we try to approach things. So it's not always adding something, it could be taking something away. And what it comes down to is naturopathic doctors are aiming to treat the cause, the root cause of the problem. Exactly. And conventional care, it's not that conventional care doesn't try to do that too, because I don't think that's fair to say that. But a lot of times, the way that allopathic medicine is designed, essentially, is a palliative approach, which means that there's a symptom, like I have heartburn or my arm hurts, and so the approach is, let's get this person out of pain. Let's stop the pain. So it's a symptom-based approach. Right. Well, and it's also even, I think, both medicines, I always say this, both medicines are very important. Both approaches are very important. With conventional medicine, it's about keeping your body alive. It's keeping your body alive. So usually when you're in the acute situation and you're dealing with either a lot of pain, or you're feeling suicidal, you're feeling a lot of severe things, we want to make sure that the body's kept alive. And conventional medicine does very well with that. But it's not a complete cure. It's something to be able to give a medication to keep the body stable from it destroying itself, right? But in the long run, we want to see, okay, what is the cause of that problem? Why did it happen in the first place? Trying to find the root of the problem to be able to address that. And sometimes it is going back to the basics and the simple things of such as nutrition, lifestyle, that might have been somewhere in our life implementing it. So a good example, I think, is a lot of times in conventional care,
their version of finding the root cause might be saying, well, they have, you do all this testing.
Yep.
You go to the doctor, you do testing. They say, well, you have Crohn's disease. Mm-hmm. That's the root cause of your problem. Yep. That's the root cause of your symptoms.
Yep.
It's because, and we went in with the scope and we saw it, you have Crohn's disease. But our mindset as naturopaths is saying, well, why?
Yeah.
Why did you develop Crohn's disease?
In the first place.
Why did you develop ulcerative colitis? Why do you have heartburn?
Yep.
Why do you have GERD?
Yep.
And honestly, a lot of the time it has to do with food.
So sorry, you were saying that as far as the Crohn's disease, that analogy.
Yeah. So basically, in conventional care, if you had Crohn's disease and they did all of the testing to figure that out, that would be their root cause.
Okay.
Whereas with naturopathic medicine, we're going to be saying to ourselves, okay, you might have Crohn's disease, that's your diagnosis.
Right.
But what was the actual cause? Like, what caused you to get Crohn's disease?
Yeah.
And a lot of times, people will say, oh, that was just genetic. Oh, it's just genetic. Oh, well, I had a... But
right.
we can't always blame it on that for many of these conditions, because Crohn's disease specifically can be caused by different dietary intolerances that we have to things.
Yep.
Ulcerative colitis, GERD, or heartburn. These are things that are caused by things that we're eating, and that's our belief as naturopathic doctors, is that when our digestive system, when we're not digesting our food correctly, we're getting inflammation in there, and maybe we do have a genetic predisposition to get something like ulcerative colitis, or get something like Crohn's disease, or have heartburn. Maybe we're more susceptible, but ultimately it does have more to do with what we're putting in our bodies and how we're digesting our food.
And it could be even the mental emotional side thing, especially with a lot of digestive issues.
Sure.
This is where I always talk about the triangle of health. So a lot of, like, when we're looking at conventional medicine, they focus a lot on the physical acute situation. So the example of Crohn's disease, they're going to look at, okay, it's all really messed up down there, so we might give you certain medications that are going to kind of hinder from that happening. But if we're not addressing what could be a nutritional or allergic response that's going on, that might be the root of the cause of the problem, there's the biochemical side, right? So there's the physical, there's the biochemical side that we need to address that could be the problem, and then there could be also the mental emotional, especially with people who deal with irritable bowel syndrome.
Oh, sure.
Anxiety and stress can be a big contribution to why people have irritable bowel syndrome. Right. So that's why that's what holistic care is looking at the individual, saying what could be the problem, and making sure we're addressing all aspects versus just the acute symptoms that are being presented, or the physical symptoms.
Because we're all different.
Yeah,
every single person
we're all
is
made up differently.
We're all going to have different sensitivities to different foods.
Yep.
And it's a matter of finding out what those are. So jumping back to the Crohn's real fast, I do want to clarify that a lot of times gluten can be the cause of that. In modern medicine, your doctor may, is going to probably tell you to stop eating gluten.
Yeah.
But what if there's something else that's just as much of a problem?
Oh, exactly.
Just because now gluten has been researched very well to contribute to something like Crohn's disease.
Yeah.
Right?
Can or cannot be, depends.
Right?
Yeah.
So it's been researched very well. The doctors say, yep, it's been pretty much shown in science to cause this problem. Stop eating this food. Well, what about something like dairy?
Yeah.
Okay? What about something like dairy? What if you have a sensitivity to dairy? What if you're not breaking that down? And that's what's causing your Crohn's disease.
Oh, exactly.
Well, you're going to need to be on medications to be able to continue eating those foods.
Yeah.
So that's why you come to naturopaths, to providers like us, to be able to identify what you can and you can't be eating, really.
Exactly. It's just a different set of tools, a different set of eyes, a different way of looking at that could be causing the root of the problem, and be able to address that. So we just wanted to make sure that you kind of understand what naturopathic medicine is, what are the principles. I mean, we can go all day about this stuff.
We really could,
But I think it's a good summary to kind of get an idea of why, we found naturopathic medicine to be so important to us, and that's why we decided to go that route as doctors, because we felt like it was a way to kind of that a piece of the puzzle that's missing in the medicine, and that we need more of us. So if you are somebody that's considering, maybe have been struggling with lots of different doctors, it might be looking at a different set of eyes, seeing it through a naturopathic doctor. If you're located here in the Snoqualmie area or somewhere close, we're right here. It's Blue Water Medical is our clinic. Mm-hmm. And, if you have any further questions, you can always leave that in the comment section below as well. So
yeah. All right.
Okay.